Brendon Tainsh, who I was able to gladly honour for his work with life skills, is now the Australian manager of LivingWorks. LivingWorks we use a lot of their programs, as does a lot of major organisations around the world. And so Brendon's come to present to us, so please make him welcome.
Excellent, righto, cool, thank you. All right. Firstly, I would also like to thank the Construction Industry Mental Health Committee for running this conference, and particularly for Mates of Construction, AusHelp and EncoLink, who have helped pull it all together and have contributed immensely to making this event the success that it already is. I want to start, first of all, just by talking a little bit about what we are. This is going to be a slightly different shift in relation to some of the different talks we've heard so far. I'm coming more from a practical skills base, and we're going to be talking about ASIST in a little bit. So we are an organisation that develops four major trainings: Suicide Talk, Safe Talk, ASIST, which is Applied Suicide Intervention Skills Training, and Suicide Care. And we're all about raising awareness and developing skills training so that people can feel confident and competent to know what to do with helping people at risk of suicide. We also aim to try and help make the current knowledge about suicide more accessible, more readily available for people to use, and so it can be used on a broad spectrum of communities across Australia. We just set up a national office in Canberra. LivingWorks has gone through a number of different transitions over the years, and this is the first time that LivingWorks has actually taken up the mantle of running its own operation here in Australia. And so I'm in the process of setting up our national office in Canberra. And as a result, what we're trying to do now is to continue to raise the profile of the organisation and of what we can do to contribute towards suicide prevention in our country. So some of our core beliefs around suicide prevention, which I think are important to start off with, because I think it's important for us to understand where we're coming from, and everything I believe that we've been talking about today will be backed up by what we also believe, which is, first of all, that suicide is a major community health problem, and that thoughts about suicide are understandable, complex and personal, and we've heard some of those testimonies today, just the complexity around the issues around suicide, and it is particularly personal for people. But more importantly, and I know this is one of John's big mantras, because I've heard him say it so many times, is that suicide is preventable, and we agree. It most definitely is preventable. And I'm going to tell a little bit of a story in a minute, which will just highlight some thoughts that will expand on that. Help seeking is encouraged by open, direct and honest talk about suicide. We heard Dave Noonan and John Criddle this morning talk about the fact that how important suicide prevention is within the construction industry, and that we need to do something about it, and what we can do about it is talk about suicide. It's important that the subject is open up. Stigma is a major problem, and because it's a major problem, it stops people from talking about it and coming out and feeling like they're safe enough to come out and talk about it. And we also believe that suicide is a relationship-based context. So it's important for us to understand that everything that we do, it's about people. And so we are all about relationships and helping build those relationships with people. Now, I think every presenter, or just about every presenter, has done something on our stats, and I'm just going to do a little bit, but I'm doing it from a point of view of trying to have a look at not so much the data and the statistics around, but more the impact, the social impact to us as people. And as you've seen so far already, sorry, I'm just getting used to the fact that we're looking down here and up there. So in Australia in 2011, we had 22 million people, approximately 22.5 million people in our country. and our reported suicides are 2,273. And our little diagram shows you that it's an iceberg. And what we see is that's the actual reported suicides, those that are defined by the coroners and said this is an actual suicide, and they're the one who sign off on it. And we know that that's the actual statistical number. But unfortunately, the story goes below the borderline and goes down below further into the iceberg. So then we have to look at unreported suicides, which are somewhere between 5 to 25% more. Now that figure is probably very, very conservative, because we know that there are a lot of reasons why the number of suicides that are not reported are extremely high. So, and they can be things like, a car driving off on a straight road, and there can be drug overdose, and we wouldn't know if they're necessarily a suicide. Also, suicide behaviours, that also opens up the whole door of saying, well, somewhere between 40 to 100 times greater than the actual number of suicides. Those thinking about suicide, those actually attempting it, but maybe don't complete, are 40 to 100 times greater. So that puts our statistics up considerably higher. But this is the most important part for me, and this is the part that I've heard so much today from everyone who's come up here and spoken, and in the conversations I've been talking to others about, that one suicide can affect so many people here and within the communities around Australia. It was Emma this morning asked a question. She asked if everyone could put up their hands and show how many people here have possibly been affected by suicide. And I think good 80% of the room put their hands up. So if you stop and think for just 1 second about the impact of what that relationship that you've experienced and what impact that's had on you, and how many people that's affected around you, and then you look how many people there are in this room, and then what that means on an Australian context, we're talking about a huge amount of damage to Australian people's lives. Not just those taking their lives, but all those left behind afterwards. So what we know is that people with thoughts of suicide are approximately 1.2 million people in Australia in a given year, and that's and what that talks about is the fact that's 1 in 20 in our population are having thoughts of suicide. So it's important. Suicide is a major health problem, but it's a major societal problem, because it leaves a lot of people damaged and a lot of people hurt, tremendous amount of grief, and leading on to depression and other mental health disorders that possibly could be a result of that as well for family members left behind. So a little bit about ASIST. It helps prepare caregivers in providing life-assisting first aid intervention for people at risk of suicide. Basically, it's a suicide first aid course, and it's a 2-day course which we offer and is run by 2 trainers. Just recently, there was and I invite you afterwards over in the back corner, you'll see there's some, on a table, I've got these, which are the new Madeline Gould research, and they're available for everyone to get hold of back there. But Madeline Gould has a PhD in research, and in 2013 she did with the National Suicide Prevention of Lifeline in the United States 1,500 sample group of actually looking at suicide and how ASIST actually works. The research showed calling Lifeline ASIST-trained counsellors and helpers were 3 things. First of all, significantly less depressed, significantly less suicidal, and more hopeful about living. What's important about this is the fact that the Lifeline callers were all trained in ASIST, while the control group were all trained in other methods. This is not about people who were not trained or just using what they know about suicide, but these is a direct comparison against other methods. And so ASIST has been shown that it works very, very effectively with actually increasing hopefulness for people at risk of suicide. So I said I want to do a little quick story, and I realise time's ticking away here. It's really important that, for me, I need to have confidence in something that I'm going to use that's going to help people. I was with the previous organisation when I was with AusHelp. We're about to start a national training for all our staff across Australia, and I got into the office one morning ready to start, get things going, had a phone call, and there was a gentleman in Canberra who rang up and wanted to speak to me, and I took the call, and he basically said, I'm standing on the edge of a building and the ground's looking pretty good right at the moment. So here was a chance, unprepared, not ready, about having to say, I've got to do something here and now to save this life. So I was able to put my ASIST training into practice, and I know there are many others in the room who could share similar stories. But basically the long and the short of it was, I was able to talk him down, make sure he was safe, and then I was able to get him in the afternoon and actually have a talk with him and find out what was going on. He was happy to come and speak to me. That took around about an hour to get to that place, but when we got there, he was very happy to talk. 6 months ago, he lost 2 twins in premature birth and both died. He became significantly depressed, started taking up alcohol, became abusive to his wife, didn't know what was going on, and she threatened to kick him out. And on that particular morning, that's when he went up and stood on the edge of the building. He couldn't take it anymore. It was all too much. I remember stories such as what Dave Noonan said this morning about having a person stand by and say, well, you know, he did everything, he saw all the warning signs, but, you know, thought he was safe. And then unfortunately, this young guy goes and takes his life. And I feel sorry that Dave's have to be left in a position of wondering, you know, was there anything else he could or should have done? And I think this is one of the tragedies that we all feel when we're left in those type of situations. And so it's very, very tough. So I guess one of the things I really want to highlight is that we can make a difference in suicide prevention. Anyone can do this. So our study highlights that the study compared Lifeline counsellors trained in ASIST with counsellors who have received training in various other ways. The significant benefits for the person at risk calling were they received longer calls, their invitations around suicide were explored, they were connecting to invitations to thoughts of suicide. In other words, they were actually able to establish that they were having thoughts of suicide. They were able to explore the reasons for living. They were able to explore the ambivalence about dying, their concern about life and death, and they're able to explore informal support contacts. So the unique features of ASIST has proven effective in helping crisis line workers with those at risk. The second thing is that these skills are transferable. Lifeline support workers were from all different backgrounds and experience, but some were volunteers and some were social workers and psychologists. But some were people just come in with their first training, who've been trained in ASIST and worked with Lifeline. This is in the United States. And so their backgrounds were diverse. What it also showed, with all the helpers working with the person at risk faced similar challenges. In other words, there's nothing new about this. If you were to ask people who've done interventions in the room here with people at risk of suicide, they'll tell you similar stories. They'll tell you that these are the main reasons going on in someone's life, and this is what they had to face when they come to that point of intervention. And they present with those same varied issues. And I can tell you, the first time that I did an intervention was pretty scary. And no one wants to do it. No one really likes being put in that position. But the reality is sometimes we are left in a situation where we do need to. And it's good to be prepared if we do. So the goal of safety for now is the same, which means that with ASIST 10, we've just moved up to a new ASIST 11, which I'll talk briefly in a second about. But at the end of the day, it's all about keeping the person safe. And we used to talk in ASIST 10 about safety contracts, and we've now moved to a new safety framework. But what this does, it suggests that ASIST training will be effective in empowering all kinds of caregivers to help people at risk. And that's why I believe that it will and can work in the building construction industry. In fact, we actually know that it already does. And the 3 organisations have already been identified today. The AusHelp Foundation, who work in the ACT, New South Wales, WA and Northern Territory. Incolink, I don't believe Incolink has moved beyond Victoria. I think they're still just in Victoria, is that correct? Don't know if Tim's still here, no. And of course, Mates of Construction, who now work in Queensland, WA, South Australia, New South Wales. But what's important here is that, and I just wanted to highlight in terms of Mates of Construction, is that because they also use the model and they've developed it specifically for their Mates program, what this also helps us highlight is that it is synchronistic with our ASIST program is synchronistic with the Mates model. It's all about helping people. It's all about face-to-face contact and working closely with people. Yes, it is about skills and about knowing what you need to do to be able to help people at risk, but at the end of the day, it's about engaging people. It's about helping and assisting people. And it's also it also works in terms of fully integrated on-site peer training and support program. So just recently we released the new ASIST 11 version, and it's now out. It was released back in June in Canada, and it's now being released into Australia. We're going to be running an official launch, which I'll be sending out invitations very shortly, for our launch in the ACT on April the 4th. What ASIST 11 does, it helps, as not by comparison, but how it improves on ASIST 10 is it promotes and enhances the benefits of ASIST 10. The model focuses more on hearing and listening. So this is more about hearing the person's story. So for a lot of us, that's going to be really important because we want to know that the person at risk is not just, we're not here just to do the intervention about their thoughts of suicide. We want to know what's going on. We want to hear what's going on in their lives. So it's more about hearing and listening. It also improves upon what was found in the Gould study. So because the model increases more about the hearing and listening, more about what it means for the person at risk in their life journey, it helps us to be more proactive around listening to their story and being able to help them. And it aligns with the industry OH&S through the new safety assessment framework, which is now an individualised framework used for helping, instead of having one generic safety framework that fits for all, we can have a look at different factors with someone at risk, and we can say, well, maybe they just need this, maybe they don't need all of this. And so the safety framework is customisable, but it's designed in order to be able to help the person at risk so that they actually know that they are going to be safe, and it's all about collaboration and working with them. So I just want to leave you with LivingWorks, as many of the other organisations and all those represented here today are all about trying to work together to create a suicide-safer construction industry. Thank you.
Thanks, Brendon. Just out of curiosity, can I just have a show of hands? How many people in here are ASIST trained? That's great. Mason Construction actually did a bit of research independently on ASIST. So if you're interested in some of the stuff we found out about what you people are doing out there, it is amazing. The lives that are being saved through you people just using those skills, not just in construction, but in your football clubs, in your churches and in your families. So it's great stuff.